My name's Kate Gorman. I'm the Manager of Consumer Participation at the Healthcare Consumers Association.
Hi, my name's Kerryn Ernst. I'm a McGrath breast care nurse for patients with metastatic breast cancer and one of the members of the Cancer Supportive Care team at the Canberra Region Cancer Centre.
So, Kerryn, today's chat is about how to support carers and family members of people who are being treated for cancer. What's the one piece of advice you'd give to a carer starting out on the journey of supporting someone with cancer?
I think the most important thing that carers need to know is that they need to ask for help. There's lots of people here to help. We have a multidisciplinary team approach to care. So that includes the patient, their families, their carers, anyone who is important to them. And everyone here is here to help. And there's no question we haven't heard. And our role is to make life easier for everybody and answer any questions. And the other piece, if you want two pieces of advice, I'd also say it's really important to sort of gather your crew and have people around you who you can depend on, who you can ask for help. Because not everyone will offer, and people don't ask for help, but you need to be able to ask people and trust them that they'll come through.
So now is not the time to go it alone?
Not at all. Not at all.
Great. Thanks. And how important do you think it is for the carer to look after their own selves as part of the planning for that patient's cancer treatment?
There's actually evidence to show that if the carer's quality of life is impacted, it has negative outcomes for the patient, for their own health outcomes. So I think the carer needs to take some time out. And it's not being selfish and it's not being greedy or anything like that. They need to look after themselves because these days cancer is generally a long experience for people. There's a lot of treatment, there's a lot of appointments, there can be admissions to hospital. It's a long road, it's a tricky road, and I think that they really need to identify some ways that they're going to cope, be it a book club once a week, just a coffee with friends. It doesn't have to be anything too difficult, just some time out where they can just look after themselves.
So plan to prioritise that.
Plan something for themselves each week or a couple of times a week. Everyone's different. It might just be some time in the garden without anyone talking at them. Yeah. Just anything that's, it doesn't have to be the big holidays or expenses, just some time out.
So, on a similar subject, what supports are there then for family and carers who are on this journey with someone?
When people first come to the cancer centre and they meet their specialist, like I said, we're part of a multidisciplinary team, so that involves the doctors, depending on, from all the disciplines in oncology, the registrars, the cancer specialist nurses, the treating nurses, the clinic nurses, and then we've also got a great team, our psychosocial support team, and that's made up of cancer counsellors and social workers and psychologists as well, and psychiatrists. So I think if you just ask, we can direct you to all of the other resources that are out in the community as well. So if you start sort of locally, we can find the right resources for you and then refer you to them. And there's Carers ACT, there's a whole lot of resources, community-based resources.
Yeah, but people need to be sure that they ask for them.
Yeah, you can self-refer to those organisations, but I think if you really want to, sort of just get the right advice, because quite often it's not just that you need. There might be other things that the social worker can help you with. There might be carer's allowance or payment and things like that.
And sometimes you don't realise those things are available if you haven't been in that experience before.
Exactly.
Yeah, thanks.
And that's what our specialty is. This is what we do. So, we've seen it before, we can help.
So if you are a carer, what can you expect for how you might be involved in decisions about the care of the person?
That's really important. I think, especially if the patient is relying on carers to get here for treatment, I think, and also care at home, I think people need to be aware of what the experience is going to look like. So how often is treatment given? How well will they be after treatment? How long is it given for? How long will I be in the cancer centre? When someone's going to be admitted, how long is that for? What's that going to look like on in our schedule, in our family life as well, because a lot of people are juggling small children or elderly parents and then caring for someone as well. So I think there's important questions about quality of life on treatment. I think it's important to have affairs and things in order. I think, the motto is hope for the best and plan for the worst. So I think anyone with a mortgage and dependents should have their advanced care planning done as well. But I think carers just need to ask. There's people here to help.
Yeah, but they can expect in those in that treatment course that they will be sort of included and involved in the decision making, and that information will come to them. And
we can rely on them if they come to the doctor's appointments. We can rely on them quite a bit to give us an indication of how things are going at home as well. How much can the patient do for themselves? Are they sleeping all the time? Do they need some extra services in there to help? What they're eating, because patients, I think, sometimes worry they might get in trouble if they tell us that they haven't eaten, but quite often the partner's sitting behind them going, telling us a bit more. So,
and that's important information to know. They can spot things that might be really important to planning.
If they're sleeping or wandering the house at night with pain and things like that, they're a very good sort of set of eyes and ears for us.
Yeah. So would you say they should seek to be involved?
Absolutely. Yeah, and we welcome them into consults and to be at treatment as well. So we like it. We know that cancer care is it involves the whole family, and so they're very welcome to come to appointments and to speak up as well.
If carers have fears or concerns about the person they're caring for, who should they talk to? What should they do?
Well, like I said, we've got a great cancer supportive care team, so they can. We're also very lucky in the cancer centre here that we have cancer specialist nurses for nearly all of the tumour groups. So they can speak to the consultant in the first instance, and they can refer to other services. But speak to the cancer specialist nurse, who can refer you on to social work or counselling as well. And they're the experts at helping with those fears and those concerns around cancer.
Yeah. Okay, I think that's all my questions, Kerryn. Thank you.
Thank you.